Welcome back. I hope you've had a chance to make some new connections with other delegates on the platform and build on existing connections. Our next panel discussion is on innovation. Back in January 2022, Professor Tony Young reported some of the award-winning innovations the NHS will invest in through a new £1 million Net-Zero SBRI Healthcare competition. Decarbonising the NHS, as we know, is complex, but new ways of working and thinking showcased in the SBRI Awards can help our health sector get closer to achieving net zero targets. During this panel discussion, our expert speakers will look at ways of reducing carbon emissions through new innovations. So joining me for this discussion, I'm delighted to say we've got Alastair Morris, Chief Commercial Officer at Powerstar, Addie MacGregor, Sustainability Lead at the Association of British HealthTech Industries, James Freed, Chief Digital and Information Officer at Health Education England, and Pete Carpenter, Service Delivery Director at Kent, Surrey, Sussex Academic Health Science Network. Now, don't forget to use the Q&A function to be included in the conversation, and you can share your thoughts on Twitter with our hashtag NHE365. So good morning to all of you. Nice to see everybody there, that everybody's managed to hop onto the platform well. Can we start off with you, Alastair, with an overview of Powerstar and what you offer to the NHS?
Sure. So Powerstar is an engineering and a manufacturing company based here in Sheffield, our headquarters, and with a site near Birmingham. We make a range of products and software, principally to save electricity. That's definitely the origins of the business. Transformers, smart transformers that actually reduce voltage and save electricity. But more recently, battery storage systems. So large batteries that sit on site, providing a range of functionality. And we installed the first one of these into an NHS trust in November last year, and have more on the factory floor now that we're working on. So a range of offerings around optimizing the use of electricity, reducing it, with multiple aims, be it cost or carbon emission savings.
Fantastic. Addie, in the context of the health tech industry, what does innovation mean to you?
So innovation to us, I think, is all about solving a problem, and it's getting to better solutions. In particular, in terms of healthcare, HealthTech can really aid in getting better patient outcomes overall. We need to keep innovating in order to keep going.
And James, why is innovation so key now?
So innovation is absolutely essential, I suppose, in order to take advantage of the great opportunity that change has for us, but also to try and mitigate some of the risks. So from the perspective of climate change, of course, that's changing faster than it ever has before, but it's not the only thing that is. Geopolitical environment, but also the opportunity from data, information, knowledge and technology, and how we can use those in our day-to-day lives and at work is increasing at an exponential rate. Now, in order to use those things, those opportunities, but also address those risks that are moving so fast, you need to create a different paradigm of how you work as an individual in the workplace or at home and in your life, but also as an organization. And some of the work that we've been doing in Health Education England has been how you capture that, how you create the right environment for innovation to flourish.
I like the way you use opportunity, actually, because I think particularly with sustainability, a lot of sectors see sustainability as a looming target. It's something that has to be done. It's potentially costly, but actually it can be looked at the other way around, can't it, James, as an opportunity to improve people's lives?
Yeah, I wholly agree. So and maybe we'll get into this a little bit later in the discussion, but change, innovation is a type of change. And change is all about people and perspective, and how you phrase and how you get people excited around that change really matters. It has a tremendous impact on the success and the impact that you have. And if we want to try and meet the targets that we've set for ourselves, which seem distant but are incredibly ambitious, then we need to be really focusing our efforts, not dissimilar to the way in which we all focused our efforts in March 2020 when a pandemic suddenly hit us all.
Well, it certainly showed us, didn't it, how powerful bringing lots of brains together can be, and when we all pull together, what difference we can make. Pete, you were last, but certainly not least there. If you want to add to any of the thoughts of our guests so far, and then I was going to ask you about, obviously, great things are being done within the NHS, but what we can learn from other sectors.
Yeah, great, thanks. So just building on some of the comments so far, I think there's a huge opportunity, and we see that in the NHS from everything from looking at supply chain to the adoption of digital tech, what that means in terms of patient transport, for example, and I think there some of the points that have been made in terms of how we really shift the dial in terms of workforce. It is the real challenge. Just in the context of the pandemic, I think one of the reasons that the NHS excelled in response to the pandemic was because of innovation, and we need to build on that as an opportunity. For me, innovation isn't around necessarily tech widgets, but new ways of working, new service developments. And we need to build on the foundation from the pandemic, I think, because there's a huge amount of learning that's come out.
But how can we harness this learning, if you like, Pete, and share it as well, to make sure that you're all not going through the same journeys and solving the same problems and rising to the same challenges, but solving the problems collaboratively? Yeah,
I think that's where the role of networks has a big role to play, really. So I think for me, it's very much around harnessing great work at a local level and looking at how we can support the spread and adoption of that, often through developing communities of practice, shared learning and collaboratives, but actually measuring the impact, particularly from a net zero perspective, that change has. So there was a comment around the possible perception that change in relation to sustainability can be costly. And I think the evidence is quite the opposite. I think if, certainly from case studies we've looked at in terms of, for example, supply chain around surgical pathways, this is improving patient outcomes, it's better for the environment, and it's cheaper. And I think for me, one of the things that we've got to learn to do is harness the enthusiasm, the passion, the commitment at a local level. Change is not going to be achieved top down in the context of sustainability challenges for the NHS. Of course, policy is important. Of course, procurement obligations are important, and that change is welcomed. But really, we need to support teams and drive that workforce change bottom up.
Yeah, I think changing the narrative starts, doesn't it, with local community. It's a very powerful place to start. Alastair, I know that Powerstar's recently published a white paper about the NHS's energy trilemma. Can you enlighten us and just explain a bit more about what it is?
Yeah, an energy trilemma rather than dilemma, because three elements to it. So the kind of three real pressing needs for our energy at the moment are sustainable energy sources. We're talking about net zero. Our energy needs to be sustainable. It needs to be affordable. And this has really, over the last 12 months, come to the forefront of everybody's minds. But it also needs to be reliable. And the three of them potentially pull in opposite directions. So by solving one of them, you potentially make one of the others worse. And balancing those three arms of the trilemma is a key topic.
You mentioned in your first answer, you mentioned battery storage, and I think there's a lot of solar's being put in around Britain, but battery storage and the benefits perhaps sometimes missed off. Battery storage actually creates revenue, doesn't it? And energy saving all at the same time. Yeah,
so there's four real benefits to a battery storage system that sits on a site. Three which are common to any battery storage system, and one is the kind of innovative piece that Powerstar offers, and particularly beneficial to critical care facilities. So the obvious one, the one that people think of most, is balancing renewables. So you can store energy from a solar panel when it's sunny and use it when it isn't sunny at night. You can store when it's windy and use when it's not. So firming the renewables. The second one is, as you mentioned, a source of revenue. So there are grid services contracts. You can basically sell some of the capacity of your battery back to the national grid. And there's different types of contracts, but they provide flexibility for the grid. They provide capacity to the grid, and it actually becomes an income stream for whoever owns the battery. So while this battery is sitting there providing with other functionality, you can get some money back from it. One that's not particularly well understood, but is becoming an increasingly big topic, is about grid connections. So this energy transition that's going on, the way that we're upgrading everything, we're trying to decarbonize our electrical supply. We're electrifying a lot of things, but the national infrastructure is not in a place that we can necessarily do that. We can't necessarily connect everything that we want to the grid. We have to pay for upgrades. We have to wait for upgrades. The battery can be used as a buffer. And basically reduce your peak consumption of electricity from the grid by using the battery intelligently to manage the loads on site. And you can save a lot of money. You can achieve things more quickly in terms of decarbonisation that you wouldn't otherwise be able to. And the unique piece is the one that addresses the reliability arm of the trilemma. So our battery storage systems can be used as a UPS, so an uninterruptible power supply, which critical healthcare facilities already have to ensure that there is no disruption to power. But a traditional UPS system consumes a large amount of electricity, so it wastes maybe 10% of electrical supply going through it. But we've innovated in the way that we provide that functionality with a battery system. So, a 1 megawatt battery could save maybe £250,000 worth of electricity, the carbon that's associated with that, and get all of these other benefits from a battery storage system.
Addie, we all know that the NHS is under incredible pressure. How do we make room for innovation, and so it's not seen as a nice to have?
Innovation is critical. It can't be seen as a nice to have, it just is critical. That's how it is. Coming from the Association of British HealthTech, we have 330 members that cover all sorts of medical devices, digital health, diagnostics, like such a broad scope of things, and all of those products help us move forward. But we need to keep innovating, and it's necessary. Since 1948, the average lifespan has increased by 13 years, and that has been working alongside the NHS and with clinicians and with pharmaceuticals and with HealthTech in particular. It would not happen if it wasn't for innovation, and particularly with the sustainability agenda, we can't keep going as we are. We have to change things, and the only way we can change things is through innovating, and that's the only way we're going to meet these sustainability targets.
So, James, how do we foster an environment then that's conducive to innovation?
Well, I think first it's probably worth recognising why we don't necessarily have the environment which fosters innovation at the moment. Yeah. So we work in the health and care world. It's a risky place to work. When we make changes that don't work, it can have a significant impact. Let's be blunt about this. If we make a change that goes wrong, then people can die or we can harm people. And consequently, and so the second part of that is that we're a publicly funded set of organisations. And that means that we have got a higher level of requirement in terms of openness, transparency and probity than private sector organisations do. Appreciate that the pitch is balancing a little bit over time. This concept of corporate responsibility is becoming something that affects all sectors. But nonetheless, at the moment, we're in an environment where if you make a mistake, it might hurt a lot of people, and it might be extremely embarrassing as well, and people get sacked. So consequently, we've got an environment which is very hierarchical, and it's quite difficult to make significant change happen quickly. What we have noticed, regardless to any sort of change, any sort of innovation, I've got a particular interest in digitally mediated change, but digital is just a tool set, and it is not there as an end in its own right. It's a means to an end. I entirely agree with Pete's point about this is not about widgets, it's about outcomes. Yeah. you need to have an organization that is able to balance its risk appetite, what I might call its governance, with its appetite for innovation, and being able to create an environment where people are able to make changes rapidly. Now, you do that by essentially democratizing power. You push the ability for significant decision making and significant resource as far to the front line as you possibly can. Now, what that normally means, the teams running services, ideally involving patients and service users in the sorts of changes that you're trying to make and the sorts of designs that you're trying to make. You empower people, and as leaders, you really drive the reason why you're trying to get those empowered changes to the fore. Now, we've got a really clear message about our quadruple aim about trying to reduce costs, improve the life of both our staff, but also our service users, our patients, and the public. And the safety agenda is really, really important. Sustainability needs to be right up there. So it needs to be something front and center for health provider organizations to recognize. Because if we make that one of our 4 or 5 key aims for health provider organizations and invest in our front of house teams, the desire to try and make a difference, to shift the dial on those things, provide them with the right amount of power, but put the right level of governance in. So you're not stifling innovation, but you are capturing the bad things before they happen. This concept of fail fast comes from the digital industry, and the idea is to test in as small and as safe a way as possible so that you can get your riskiest assumptions out first. Then you can get that balance right. But to say that was easy would be a lie. So what we've been doing is supporting NHS boards, something with a program actually delivered through NHS providers called Digital Boards. I'll put the link in the chat in a second, but it's to help boards wrestle with how do they get that balance right between governance and innovation safely.
Gosh, yeah, it does sound a really, really difficult balance to strike, but it sounds like an awful lot of thought's gone in behind that, because that is key to success, obviously. Pete, your thoughts on that, and also, what else are the current challenges and barriers, and how can we solve them collaboratively?
Yeah, so I wanted to pick up on a word that James used, which is power. And I think in the context of innovation, spread and adoption and driving real change, I just wanted to build on the point around shifting that power to the front line, I guess. I don't like that expression, but I think it's helpful to consider in real life, what is it that makes innovation stick? And I think that there are 3 aspects to it. One is around making change very actionable and real for people in their day-to-day life. So in the context of sustainability, we'll only see real change if people see that benefit day to day, and there's a simplicity to changes we're seeking. So action and innovation being actionable and simple is really important. I think the second thing is around building collaborative communities. And I think innovation sticks when we think about the connection between people feeling part of something, part of a movement, perhaps in new power terms. And that connection and enabling that connection in adoption of innovation is important. And then I think the last point I wanted to make is just around adaptation. So what I mean by that is people being able to adopt innovation into their clinical practice, into their day-to-day work very, very easily. And there being a fluidity to and flexibility. So the real change that sticks is when solutions can be adapted into different clinical spaces or clinical pathways in different ways. So I'm not sure if any of that was coherent, but I think there are some principles there that sort of help enable us to think about what we need to do to ensure that power shift is at the front line, so that change really does happen, and we see that day to day.
And do you see that change, Pete, as one of the biggest challenges that you have to overcome to make innovation stick and to to make community part of it, and for people to see the benefits in their day-to-day lives?
Yeah, and I think this stuff is hard, isn't it? I think what we've talked about workforce and workforce perspectives, and we're in a situation, as you were asking Addie, where clinical staff are under more pressure than they have day to day. But I think in terms of we need to think about using these sorts of principles, these ideas, to enable people to make room in their day to day for innovation and change to happen. It has to be real. It has to be simple. It has to be adaptable into different day to day solutions and different day to day challenges. And I think we need to think about community and developing those communities of practice, because I think humans learn through each other. We learn through that connection.
I think you're right there. I mean, Addie, the journey to net zero is going to take a lot of collaboration and effort from all parties. If you've got an example of change that you're seeing from the health tech industry as part of this journey, and new habits that are perhaps forming to help us on our way.
Certainly from within the industry, obviously there are, as has already been touched on previously, there's a lot of barriers in healthcare that other industries don't have. You can't just make the plastic thinner in a catheter and hope it'll be okay. So there are a lot more challenges, but from that there's a lot of very innovative thinking. They're not cutting corners. So we're seeing businesses that are completely changing their entire product life cycle in order to, from inception of design right the way through to end of life. So some people are creating their materials from different types of plastic so they can actually be recycled more easily, and they're changing the design so that they're using less packaging in the first place. And they're, particularly when it comes to collaboration, it is going to take a lot of collaboration, and that is something that we have seen from our members in a way that they haven't perhaps for other things that are more competitive. It seems that everyone really does understand that in order for us to meet these net zero targets and become more sustainable, we have to do it together and collaboratively. So we're seeing a lot of very positive movements from within the industry.
I think as well comes from the fact, that we all realise once we go home from our work environment, whether that be a hospital or a health centre, that whatever career we're in, we all have to make a difference in our personal life, isn't it? This isn't just something for the workplace. It's a massive lifestyle change for all of us. Alastair, sort of a big question. What do you think are the key steps for the NHS to achieve what are, brilliantly ambitious net zero goals, the world's first health service to achieve net zero?
Yeah, it is very ambitious and forward thinking, and therefore it really touches on what everyone's been saying about the need to be innovative, the need to accept some risk, manage that risk, but to put things in to change the way that things are done. I'm actually fairly positive about it. Actually, we work in a lot of different sectors, and I see other users of power more nervous about changing the way that they generate electricity, the way that they use it, the way that they protect their critical facilities. Whereas I see, a genuine eagerness to adopt innovative ways of managing electricity to make sure that it is less carbon emitting. Really tackle where the sources of energy are, electrify the things that are not electric, and ensure that electricity is renewable. At the end of the day, if we manage to do that with everything nationally, huge impact. So I'm feeling very, very positive about the place that the NHS is in.
When we do these conferences on the various sectors, we always have a section in my notes that says skills. James, how have you supported the digital data and technology skills in the NHS? Because we are needing a very different skill set to we perhaps needed a decade or 2 decades ago.
Yeah, thanks very much for that question. So in three broad ways. So we did a little bit of research right at the beginning, because digital skills is one of those things that's extremely broad and getting broader by the day. You know, when you experience, as we all do, that exponential change around opportunity or digital availability that we're all experiencing, it doubles every 2 years, the processing power of a computer chip. And what that means is there's basically twice as much opportunity around today as there was in 2020, which is a bit nuts. And that doubling process has been going on since the late 60s. You know, this is not a recent thing. That's why it feels so darn fast and so scary and so difficult to keep up. So we did some research which identified that in order to be digitally ready, we need both individuals and organizations that are digitally able and digitally willing. So digital ability, or being digitally able, is your typical skills, your capability piece. But there's a real willingness piece there that's so integral and necessary. It comes through what we've been talking about today, about how you create an environment for innovation, for instance. But this concept of there being an organizational responsibility and an individual responsibility is quite an important one as well. So individually, we're trying to support the development of a digital data and technology professional workforce. We know that we're about 30,000 whole-time equivalents short for 2030. We know that more and more people are going to be taking a digital string to their bow, both clinicians and non-clinicians in healthcare provision. And we're developing a number of different educational routes. So if you're a clinician right now, you can apply for something called the Topple Fellowship. If you're working in an integrated care system, you can apply for our Yale Digital Leadership Program. If you are an aspirant chief information officer or chief clinical information officer, we're partnering with Imperial to deliver a digital health leadership program, which is a year-long postgraduate diploma. And we're trying to, in all of these different areas, create bite-sized learning that we're going to make open, so anyone can access it at any point in their career.
Fantastic stuff.
We've developed a digital literacy framework for all staff, and I've mentioned the digital boards work for senior leaders. So it's a fairly comprehensive but growing package of educational provision.
Oh, and an essential package as well. Pete, we're drawing close to the end of our panel, but I've got a couple of quick questions for all of you. What does net zero mean for innovators who are trying to access the NHS market?
I think at the moment, in the short term, it means needing to think about the development of their carbon reduction plans and developing expertise in being able to demonstrate how their solutions will support the carbon reduction ambitions for aligned to net zero. And I think for many innovators, particularly SMEs, they need a lot of support with that. Perhaps more medium-sized and larger companies have a lot of expertise that they can draw down on, and there's a need to look at developing tools to help innovators be able to calculate their carbon reduction ambitions.
And just briefly, what areas of highest impact are you focusing on right now?
So at the moment in our work, we're particularly focusing on respiratory medicine and the shift to dry powder inhalers. We're looking at driving pathway change aligned to some of that prescribing. We're looking at topics around waste management within healthcare and the infrastructure changes that are required within secondary care provider services. The other aspect is looking at modelling around the opportunity with digital solutions and what that means, both in terms of calculating potential impact in terms of patient journey and also staff journeys and those changes. So those are some of the areas that we're looking at the moment. Fantastic.
Addie, thinking ahead to the next 10 years, what innovations can we expect to see more of, both within traditional healthcare settings and also at home?
So I think, I know there's very little time, early diagnostics is going to be a massive thing. There's going to be a lot more opportunity for people to be tested at home, to have remote care post-operatively, to reduce readmissions. Again, as already mentioned, it's not necessarily just about the toe, but changing the patient pathway, which in turn will become more sustainable, because the most sustainable hospital stay is the one that doesn't really happen at all.
Alastair, final word to you. I mean, obviously exciting times now, exciting times ahead. How are NHS trusts able to fund this new technology and embrace some of what organisations or companies like yours offer?
Yeah, really key question. I think the funding of the innovation, often these things are investments in order to provide the benefit down the line. There are ways, however, to finance the investments, and we're particularly looking at putting a package together that means that we can provide net zero, we can provide energy savings and the benefits that we offer as a service, so that this is it can provide an energy saving from day one without upfront investment. Because I think that's really key to getting these things over the line without kind of a suddenly needing a step change in CapEx spending.
Brilliant. Thank you very much. Well, another great conversation. Thank you to those who joined me on the stage, to Alastair, James, Addie, and to Pete. Brilliant conversation. I always want them to last longer. And certainly not least, but thanks to you for listening in and hopefully being very engaged with what our expert audience has had to say. It's time right now to take another break to re-energize ahead of more great thought-provoking discussions to come. So this is your opportunity to discover our NHE365 platform, inclusive of the digital marketplace and on-demand content, as well as the networking functions that you may have used in the first break. So I'll see you for our next session. We will kick off at 11:35.